What are dental implants and how do they work?
Dental implants are basically artificial roots that goes into your bone, and dental implants are recommended to patients who don't have any teeth, or even like say in a situation where they have a missing tooth. Any missing tooth can be replaced with a dental implant, and they are basically artificial roots that goes into the bone, and on top of it we fix an artificial cap, and they get the tooth and the smile back.
What are the different options for replacing missing teeth?
So when a patient walks in with a missing situation, there are different options here. You can consider a removable replacement option or a fixed replacement option. So with regards to the removable replacement options, that's where dentures come into play. It can be a partial denture or it can be a complete denture. And of course, removable dentures are a viable option, but in some situations, when it comes to efficacy and chewing ability and stuff, fixed is any day better. So, with regards to fixed, if we have some teeth supporting on either side of the missing teeth side, then you can consider something like a dental bridge, which we call it as a fixed partial denture, where we take support of two adjacent teeth and fix it to the bridge and replace the missing teeth. The other form of replacement are dental implants, where you place artificial implants, which is basically made out of titanium, which is completely biocompatible, and that goes into the site where the missing teeth are, and you fix a tooth on top of that particular implant.
Who is not a suitable candidate for dental implants?
Dental implants do come with certain limitations. It can't be done for anyone and everyone. It is better for patients to visit the dental office. We need to go over their medical records, their medical history. There are certain situations where you can't perform a dental implant, and we might have to go in with more conventional removable prosthesis in such patients. For instance, a patient who has had a recent myocardial infarct, which is basically like a recent heart attack, we can't do a dental implant immediately, and we might have to monitor his health. We might have to see him probably after 6 months or 8 months. We need some medical clearance and updates, and then we'll have to go over the treatment plan at that point in time once his health history improves. That is one. Or say, for example, when there is no bone at all, literally no bone support for us to put a dental implant in, then yes, of course, there are certain situations where you can graft the site, build the bone volume, and then go in for a dental implant. But sometimes it is not a good option in certain situations. Say, for example, if the patient has had a recent radiation therapy for his jawbone for some cancer purpose or something, they've got recent radiation history, so they are not a viable patient for dental implant. Or if there is a situation where there are multiple failed implants and their gum support is not great, their hygiene maintenance is not great, so it is better we assess patients individually. Yes, of course, there are limitations and contraindications for dental implants too.
What are the next steps for getting a dental implant after a missing tooth exam?
So if in case, again, I can split this option into a missing tooth segment for a front tooth aesthetics spot and a missing tooth for a posterior molar where they mainly need it for function. So when it comes to the anteriors, it becomes more of an aesthetic requirement. And when it comes to molars, it's going to become more of a functional standpoint. So in both ways, dental implants are an excellent solution. If it's and the treatment option is going to vary depending on what sort of rehabilitation you're going to do. If it's going to be more on the aesthetic zone, it's going to be completely driven by smile and more from a cosmetic standpoint. So when a patient walks in with a missing front tooth, we do something called as a digital smile design, where we take clinical photographs of the patient smiling. We do a digital mock-up and we make over a smile on the photograph and show it to the patient, like this is what your tentative smile is going to look like if we were to plan something like a replacement on those edentulous sites where we want to improve the smile. And then once that is approved, we then make a scan of the patient intraoral situation, and then we scan that and we make a digital imprint of that 2D photograph, and we convert the 2D into a three-dimensional design, and then we work on planning a dental implant. So it's not directly like, okay, a patient walks in with a missing front tooth, I need a dental implant. It's not that easy where we just bring the patient the next day and then we put the implant in. There is a lot of aesthetic assessment that needs to be done. So it's more of a reverse engineering where we make the final crown design first, and then we position the dental implant according to the space and the aesthetic requirement that the patient needs. And that would be for a front tooth situation. Whereas if it is going to be for a molar situation, we assess the patients, we go over the basic medical records and assessment and all those stuff. And then we do send the patient to get the 3D bone scan done to assess the bone quality and the quantity. And then we plan the case digitally. And then we bring the patient in for the surgical phase as soon as we do that.
Is getting a dental implant painful? And what is the recovery like?
So with regards to dental implants, if it's going to be a straightforward dental implant placement, I would say probably a day the patient might have a little bit of soreness, and then they're back to normal. They can get back to your routine and stuff. If it's going to be a situation where we have to do some invasive procedures, where we have to build the bone volume, we need to graft the site, we need to put the implants at the same day and then graft it, then yes, probably I would say 3-4 days of soreness. But again, the discomfort is not going to be great as compared to when a patient gets a tooth pulled out. So a dental extraction would be more complicated and it requires more healing than the patient experience for a dental implant. I normally tell my patients that 70% of the intensity what they have experienced for a dental extraction during healing is not going to be there with dental implants. So it's just 30% as intense what they would have experienced with a dental extraction during healing is what they're going to expect from a dental implant treatment.
Can a person with no teeth get fixed teeth with dental implants?
In a patient who has no teeth, the first step either ways would be to fabricate a removable denture, because we need to assess the height, aesthetics, function, the position, and the height of the jaw for that particular individual. And then from there, we go ahead and get the 3D scans done. And then we place like a minimum of 4 implants in the upper jaw and minimum of 4 implants in the lower jaw. We call it as all on X, where X belongs to not 10, it just however number of implants you're using, you can use those. If it's going to be 6 implants, it's an all on 6. If it's 7 implants, it's all on 7. If it's 4 implants, it's all on 4. So X doesn't mean that it is 10. It's any number of implants that we put on a completely edentulous situation of the upper jaw and the lower jaw, and we fix the teeth on those implants immediately. So it's an immediate fix solution. Of course, the first step will be a removable solution. That is just a transitional phase until the planning is complete. And once the planning is done and everything is ready, on the day of implant placement, the removable prosthesis becomes a fixed prosthesis. And of course, it has its maintenance and everything. And then we bring the patient back in 6 months and then convert that temporary fixed prosthesis into a final fixed prosthesis.
How long do dental implants last?
Dental implants, like any other artificial prosthesis, the longevity of dental implants is also very good. But again, it comes at the end of the day, it has multiple factors involved for the longevity. Number one is patient hygiene maintenance and recall maintenance. Yes, we do have to visit the dentist every 6 months to get a periodic cleaning done, just like maintaining any other teeth. Just like buying a new car, you service it. The same way you get a dental implant done. If you're not visiting your dentist after getting an implant done, then you never know. It might fail. Just like a car brake failure without a service, a dental implant can fail too. But with periodic maintenance and periodic dental visits and checkups and with proper hygiene maintenance, A dental implant will last really long. There's no definite timeline. If you look into the books, I can say a 10-year survival rate for a dental implant is like around 97%.
Do dental implants require special maintenance? Or is standard oral hygiene enough?
So, with regards to dental maintenance, whenever you're coming into the office, it's better they inform the hygienist that those are dental implants. So, we have special tips to use around dental implants while they're getting the teeth clean. And other than that, the routine hygiene measures at home, which they perform, like flossing or using mouthwash, is going to be very good for the dental implant maintenance. And additionally, I do recommend using a water flosser. Waterpick is one company which you find it in the market in the North American market, and there are other economic options of water flossers, which basically cleans the area around the dental implants and the gum which is artificially created in that particular spot with a spray of water, which is going to cleanse that particular site. So water pick or water flossing is something which is going to be beneficial along with routine flossing and brushing.